Greetings, everyone. I will be discussing regarding the technical guidance on zoonotic disease, prevention, preparedness, and response using One Health approach, in which I will be discussing regarding what is One Health approach, who are all the key stakeholders of One Health in India, what is the institutional mechanism of One Health, what are the key initiatives of One Health taken in India, what are zoonoses and what are the priority zoonotic diseases, what are the risk factors for disease emergence, what is spillover of zoonotic agents, how the cross-reporting of zoonotic disease is done, and at the end I will be discussing all the strategies under the prevention, preparedness and response for zoonosis. So, taking on from some of the lessons from the COVID-19 pandemic and in line with the global One Health momentum, uh, the Center for One Health, National Center for Disease Control, actively collaborated with the WHO Country Office for India to develop this technical guidance, which will serve as a blueprint for all the states and union territories to operationalize timely and effective multisectoral, multidisciplinary approach for the prevention, preparedness, and response for zoonotic diseases using One Health approach. So, on 17 March 2022, the heads of the four organizations, Zhu Dongyu, the Director General of Food and Agriculture Organization, Monique Elliott, the Director General of World Organization for Animal Health, Inger Anderson, the Executive Director of United Nations Environment Programme, and Tedros Adhanom Ghebreyesus, the Director General of WHO, World Health Organization, they signed a Memorandum of Understanding for Joint One Health Works, by which UNEP joined the former tripartite group, which consisted of FAO, WOAH, and WHO, to finally form the quadripartite collaboration for One Health. So, the One Health High Level Expert Panel, which is the highest technical advisory group for this quadripartite group, it defines One Health as an integrated, unifying approach that aims to sustainably balance and optimize the health of people, animals, and ecosystems. It recognizes that the health of humans, domestic and wild animals, plants, and the wider environment, including ecosystems, are closely linked and interdependent, and this One Health approach mobilizes multiple sectors, disciplines, and communities at varying levels of society to work together to foster well-being and tackle threats to health and ecosystems through three C's, that is collaboration, coordination, and communication. So let's understand who are all the key stakeholders of One Health in India. So first, we have some international development partners like the World Health Organization, Food and Agriculture Organization, World Organization for Animal Health, United Nations Environment Programme, along with other technical agencies like Asian Development Bank, Center for Disease Control, World Bank, and United States Agency for International Development, along with some government sectors at the national, state, and district level, which are the human health related authorities like Ministry of Health and Family Welfare, National Center for Disease Control, Indian Council of Medical Research, All India Institute of Medical Sciences, Health Department, medical universities and academic institutes, and Food Safety and Standards Authority of India, along with animal health related authorities like Department of Animal Husbandry and Dairying, Indian Council of Agricultural Research, Indian Veterinary Research Institute, Animal Husbandry Department, veterinary universities and academic institutes, and environment-related authorities like environment ministries and associated departments in the state, forest and wildlife department, and other government departments like finance department, district administrators, Directorate of Technical Education, local self-governments, and the laboratories of National Center for Disease Control, National Institute of Virology at Pune, Maharashtra, National Institute of High Security Animal Disease, labs of Animal Husbandry Department, and universities. And finally, we have non-governmental organizations and other sectors like the tertiary or private hospitals and college, food processing industry, private sector associated with human health, private sector associated with animal health, professionals associations medical, professional association veterinary, media, research and development, other sectors like welfare organizations, slaughterhouses, and private sector. Now let's understand the institutional mechanism of One Health in India. So at the national level, we have various ministries like the Ministry of Health and Family Welfare, Ministry of Fishery, Animal Husbandry and Dairying, Ministry of Environment, Forest and Climate Change, Ministry of Agriculture and Farmers Welfare, to steer the One Health coordination mechanism. And also, we have a standing committee on zoonosis, which is the highest technical advisory group directly under Directorate General of Health Services, with representation from multiple stakeholders from health, wildlife, environment, and forest and animal husbandry departments or sectors. And the National Center for Disease Control is collaborating and implementing the one National One Health program for prevention and control of zoonosis. And at the regional level, we have various regional coordinators of One Health. Currently, we have 15 regional coordinators of One Health, including 4 AIMS, which are AIMS New Delhi, AIMS Bhatinda, AIMS Bibinagar, and AIMS Rishikesh, along with 45 sentinel surveillance sites with representation from Panchayati Raj institutes, milk unions, Krishi Vigyan Kendras, NGOs, wildlife institutes, and at the state level, we have state level zoonosis center, and at the district level, we have district level zoonosis center. So the state level field functionaries include the district health services along with the state IDSP, state health department, state veterinary officer, and the forest department, who coordinates all the activities related to zoonotic disease prevention, preparedness, and response. And at the district level, we have the district level zoonosis committee, and the field functionaries include the chief medical health officer, which is CMHO, along with the district surveillance officer, district veterinary officer, and via forest department, who coordinates all the activities of zoonosis related to zoonosis with guidance from the district administrator. The block level field functionaries include the medical officer and veterinary officer and frontline workers, and at the village level, we have ASHA, ANM, and parapets. Now, there are some common activities at all levels, like joint capacity building, lab strengthening, joint risk assessment, joint operational research, joint monitoring mechanism, and periodic reviews. So this is the Standing Committee of Zoonosis established under DGHS, and currently we have 15 regional coordinators of One Health, which are established in India, including 4 AIMS, and we currently have 31 state level zoonosis committee, and 373 districts had formed district level zoonosis committees. And we have 45 sentinel surveillance sites for zoonosis. Now let's see what are all the key initiatives of One Health in India. So currently we have 2 national programs that are inspiring the states to take One Health to tackle the One Health threats in India. The first is National Program on Containment of Antimicrobial Resistance, and the second is National One Health Program for Prevention and Control of Zoonosis. We also have a cross-ministerial National One Health mission, which intends to achieve overall pandemic preparedness and to achieve, increased disease surveillance activities across the country. And under the auspices of this National One Health mission, the Department of Health, Animal Husbandry and Dairying had taken 2 initiatives. The first one is the World Bank funded Animal Health System Support for One Health, and the second one is Animal Pandemic Preparedness Initiative. So these initiatives, all this aims to improve disease surveillance activities and to increase the community outreach activities related to zoonotic disease prevention and preparedness and response. And recently, the National Center for Disease Control, along with the Department of Animal Husbandry and Dairying, they have piloted a field epidemiology training in One Health called the Sector Connect, enhancing preparedness for integrated response for enhanced capacity building. Now let's see what are zoonosis. So zoonosis, as we know, they are communicable diseases originating from the animal population that can affect human beings. So this National One Health program for National One Health program for prevention and control of zoonosis, uh, and along with multiple stakeholders, they have done one country level prioritization exercises and have come to a conclusion of 10 priority zoonotic diseases, which are zoonotic influenza, anthrax, Japanese encephalitis, leptospirosis, brucellosis, dengue, rabies, scrub typhus, plague, and Crimean Congo hemorrhagic fever. Now let's understand the risk factors for disease emergence. So there are multiple risk factors for zoonotic disease emergence, like population growth, deforestation, and forest encroachment. All these have blurred the boundaries between animal and human and animal populations, and along with the globalization of travel and trade affecting the whole ecosystem. Additionally, environmental changes like climate change and unsustained, agricultural intensification, socioeconomic factors like poverty, lack of access to healthcare services, and lack of proper sanitation or hygiene practices. All these are risk factors for disease emergence. Moreover, factors like changes in human behavior and demographics or genetic changes in the microorganisms of pathogens like mutations or recombinations, all this leads to disease emergence. So let's understand what are spillover of zoonotic agents. So a spillover event is defined as the cross-species transmission of pathogen from its naturally occurring host, which is usually a wildlife, to a new host species, preferably a domestic animal or human beings. So there are three stages in spillover event. So first stage is the pre-emergent stage in which the naturally occurring pathogens is transmitted from the wild animal to the domestic animal. And in the second stage is the predetermined. So this second stage is the localized emergence, that is either through self-limiting or spillover or large-scale spillover, animal to human, followed by human to human transmission occurs. And the stage three is the low spillover event in which, because of uh, because of unsustained because of indefinitely sustained person-to-person outbreaks, international or global spread occurs, and finally a new pandemic emergence. Now, this curve shows a hypothetical scenario depicting that early control of zoonotic disease is both cost effective and it reduces the disease transmission. Yeah, so the cost of disease control increases once the cases spread occur in humans. And let's understand how the cross repeating of zoonotic disease is done. So one rule of thumb is that if the animal health department gets to know about any zoonotic disease, then it is their responsibility to inform it to the human health department and relevant animal health department and request them to visit the premises for identifying any zoonotic linkages. Vice versa, if the animal human health department gets to know or identifies a suspected zoonotic disease, then it is their responsibility to notify it to the animal health department as well as relevant environment health sectors and request them to visit the premises to identify any zoonotic linkages. So let's understand how it is done. So after getting the information or suspecting a zoonotic disease, the physician will verify and report it to the district surveillance officer at the district level, who via IDSP, that is Integrated Disease Surveillance Program, will inform it to the district medical officer, and then at the district medical officer will cross notify it to the district animal husbandry officer. Also, district medical officer will inform it to the district administrator, medical college, medical institute, laboratory, and National Center for Disease Control, as well as the state surveillance officer, who will at the state level and who will notify it to the Directorate of Health, and Directorate of Health will notify it to the Directorate of Animal Husbandry. And at the national level, NCDC will be informed, and at the international level, the World Health Organization will be informed. Similarly, veterinarians, if they get to know, if they suspect the zoonotic disease first, then they need to verify and report it to the district epidemiologist at the district level, who via IDSP will inform it to the district animal or husbandry officer, who will inform it to the state epidemiologist and Directorate of Animal Husbandry, who will cross notify it to the Directorate of Health and also to all the district administrator, then veterinary college, veterinary institute, laboratory, and also to the DHD, that is Department of Animal Husbandry and Dairying at the national level, and at the international level to the World Organization for Animal Health. So now we will be discussing the prevention, preparedness, and response for zoonosis. So, the One Health High Level Expert Panel has defined prevention as preventing the spillover of pathogen to humans, which is termed as primary prevention or upstream prevention or deep prevention. And preparedness and response has been defined as preventing spread of pathogen to humans, which is termed as secondary prevention or down prevention. Now let's see all these strategies one by one. First is prevention of zoonotic diseases. So it has four key strategies. The first strategy is understanding infection dynamics in natural host and action strategies. So what happens is that during any natural disaster, the because of the natural disaster, the habitat of the animals get disrupted, bringing animals and humans closer together, increasing the chances of zoonotic disease emergence. So let's better understand it with an example. So this example, one example could be taken from the 2018 Kerala flood, where after the flood, the stagnant waters in the in the roads or potholes, they became a breeding ground for leptospirosis. And little did they know, the villagers started becoming ill with symptoms of high fever, severe headache, back pain, muscle pain, and fatigue. So efforts were made to improve the cleanliness of water sources, disinfect contaminated areas, and promote personal hygiene practices such as hand washing. So this is story of how the flood led to a leptospira outbreak. It taught the town valuable lessons about resilience, community cooperation, and the significance of proactive health measures. Let's see another example. So this story could be taken is was taken from the January 26, 1994 earthquake struck city of Surat in Gujarat, where because of the earthquake, it led to the disruption of rat habitants, forcing them to seek alternative shelters, which increased the risk of human exposure with rat flea and agent, which ultimately led to the outbreak of plague. The second strategy was addressing drivers of disease emergence, which could be best understood from the example of Nipah virus outbreak in Kerala. So the ICMR scientists, they did zero surveillance in bats, and to their surprise, in 20% of the bats, the anti-Nipah IgG antibodies were found, but the presence of virus were not found in any of the samples or specimens. So although the presence of anti-Nipah IgG antibodies was found in only 20% of the bats, but this presence of antibodies is an indicator for the states to strengthen preparedness for Nipah virus. Third strategy was risk reduction activities. So, for example, the WHO has given 5 keys for food safety during any outbreak, like keeping hands clean, practicing wash practices, separating raw and cooked food, cooking thoroughly, keeping food at safe temperatures, and using safe water and raw minerals. The fourth strategy under this prevention is multisectoral One Health approach, which so states and districts, they should invest their time, resources, and manpower for conducting awareness activities. So there is a whole proposed list of activities related to zoonosis, which is given in the annexure of this technical document, which you all can go through. So one example taken from this World Zoonosis Day celebration on July 6th could be one of the school awareness program. And also at the district and state level, we have zoonosis committee. So periodic review meeting of this state level zoonosis committee and district level zoonosis committee should be there to identify the best practices for addressing the gaps. Now let's see the preparedness for zoonotic disease. So it has got 7 key strategies. The first strategy being strategic planning, financing, leadership, and governance. So basically, the states needs to have a calendar of calendar of activities related to zoonotic disease, in which multiple stakeholders can also put their inputs. The second is collaborative surveillance, focusing on One Health approach. So collaborative surveillance is it is a strengthening of collaboration, including capacity building uh, at the state level, district level, to enhance or to be prepared for zoonotic disease. And then we have early warning systems. So early warning systems, so there is a whole format of early warning system. This I will be discussing in the next slides. The fourth is workforce development, and the fifth is laboratory preparedness. Basically, the all the states should have a established protocol or established policy to increase the rate of testing during any outbreak, zoonotic disease outbreak. And sixth is hospital preparedness and managing surge capacity. So at the time of emergency, the hospitals need to have the ability to increase their bed capacity, to increase their staff for managing the patients coming during an outbreak. And seventh is operational research. So the states need to have a research policy, and they should also, annually um, launch a research digest related to zoonotic disease activities. So this is the report the format for reporting early warning signals, which I was discussing in the previous slide, which consists of first information regarding the state, district, date of reporting, source, and name and designation of the reporting person, and then the possible source of signals which indicated the zoonotic disease, which can be seen through this diagram also. Like what could all be the possible sources? It could be from monitoring of routine surveillance data, then from a clinician or veterinarian in a hospital or private clinic setting or zoo. It could be from a public health or animal health laboratories, sentinel events like diseases or deaths in wildlife, livestock, poultry farmers, animal handlers at wet markets, from media, from points of entry, ports, airports, ground crossings, from community and others. And the next section, in this, we need to report any unusual increase in cases or deaths or unusual event in any area. So let's see one interesting example of how a veterinarian identified a new emerging disease. So Dr. Tracy McNamara, she was a veterinarian at the Bronx Zoo, and she observed that some crows died on the ground near the zoo. And at the same time, the clinicians or physicians in the city were observing significant numbers of cases of encephalitis in humans. So Dr. McNamara wondered if both humans and birds were succumbing to the same pathogen. So she tested the bird samples to identify that they were succumbing to the new pathogen called West Nile virus, which was later confirmed to be the same causative agent for human outbreak as well. So this figure is showing the One Health workforce development training, and this is the COVID and during the COVID-19, how the veterinarians laboratory testing was done for human samples. Now, at the end, let's see the response for zoonotic disease outbreak. It has got four key strategies. First is integrated outbreak investigation, which has the similar 10 steps of any outbreak investigation. I will discuss it in the next slide. The second is implementing joint control measures, recovery and rehabilitation. So joint control measures, for example, let's take the example of leptospirosis. So joint control measure could be like from the public health department or human health department. It could be uh, increasing the preparedness for hospital preparedness, doing hospital preparedness for managing the surge of leptospirosis patient. Then from the animal health sector, one of the measure could be raising awareness to the livestock farmers regarding leptospirosis. And from the animal environment health sector, the joint control measure could be doing a cleanliness drive for the whole village. Okay, and and the recovery and rehabilitation, basically it is essential for the for persons or people who have suffered from long-term effects of zoonotic disease outbreak. So it includes physical therapy, then counseling and social support. Third strategy under this response is risk communication and community engagement. So at the time of any outbreak, now people want to know what risk they are going to uh, go through, or what risk they are seeing, like they are prone to, and what all measures they can take at the time of the outbreak to save their lives. So this risk communication and community engagement could be done through the community leaders or social media as well, or mass media. And the fourth strategy is after action report and impact assessment. So, which is very important to identify the best practices and addressing the gaps related to the zoonotic disease outbreak. So these are the 10 steps of outbreak investigation. First, we need is obviously the confirmation. We have to confirm the outbreak and the agent. Then formation of rapid response team. Then we have to make a case definition. Then identify the cases and obtaining information. Do the descriptive epidemiology. Do additional studies like environmental risk assessments or laboratory studies. Then interview the cases and generate hypotheses. Then we have to evaluate the hypothesis. Then we have to inform the risk managers and implement control measures, communicate findings, make recommendations, and evaluate the outbreak response. So under the IHIP and IDSP, outbreak investigation is done like this. After getting the event alerts, the district surveillance officer will send a copy to the state surveillance officer and also will take action by generating an event alert ID, stating the health condition, source, and preliminary investigations. If the outbreak investigation is required, then an outbreak investigation ID will be generated and a rapid response team will be assigned for that particular state, district or sub-district or villages which are affected. Health facility will be assigned and notified. Outbreak investigation at the health facility will be started. Event information update will be generated. Outbreak summary will be made. International health regulation risk assessment will be done. Then outbreak is complete. So this is the format for the rapid response team for reporting the zoonotic disease. The first section basically has the information about the local health veterinary department, and the second section is regarding the person reporting. And then we have the case specific information separately for both the human exposure and separately and animal exposure. And then case management, human and animal are both separate. And laboratory test details we have to report. And at the end, we have to mention the disease, the zoonotic disease. We have to take it here. So WHO is providing one course regarding response preparedness for zoonotic disease outbreaks using a One Health approach, which I have done. It consists of three modules. The first will tell briefly about One Health approach, and the second module is regarding the response preparedness for zoonotic disease outbreak from a human health perspective. And the third module is regarding the response preparedness for zoonotic disease outbreak using One Health approach from animal perspective. Last but not least, I would like to pay my homage to the man who coined the term zoonosis, Sir Rudolf Virchow. He said that between animal and human medicines, there are no dividing lines, nor should there be. The object is different, but the experience obtained constitutes the basis of all medicine. Health and disease in humans and animals differ only in detail and not in kind. Thank you.